Our country has access to flat out the best technologies in healthcare. There's no other system you'd rather be in than the U.S. healthcare system. That said, it's an expensive system, and as a result, it is even more incumbent on the U.S. healthcare system to find ways to reduce cost without unduly harming quality. My work heavily draws upon the idea that our healthcare system needs a very, very large dose of organizational innovation. A lot of my research looks at the importance of familiarity amongst members of surgical teams. You would be amazed in looking at a typical hospital in the United States as to how infrequently surgical teams remain fully composed from day to day.
So research is absolutely central to the work of the school, because when people come here, they come not just to hear what was true 20 years ago. They want to find out, how is the world changing? What are the ideas that are going to influence the world that I'm going to inhabit as a business leader? And it's that restlessness about thinking hard about where business should be going that is the heart of what the research is that we do here at Harvard Business School.
HBS is a fantastic environment for researchers and educators who are really interested in marrying insights from the real world to academic research. So it's very unique in that regard. You can really contact people out in the field and learn about their ideas and then bring them out into your classroom and into your research.
Well, HBS is unique among business schools in terms of the way its faculty is organized. While we do have units in finance and accounting and strategy and organizational behavior, we also have areas that really bridge across different disciplines. I think at HBS, our going-in approach is that most of these problems are really complex, and the way to really unpack them is to begin to approach them with multiple lenses from the get-go.
I do a lot of research on competition and consolidation. One U.S. industry that has consolidated a great deal is kidney dialysis. The question that I'm seeking to answer is how consolidation of that business has impacted the quality that patients are receiving in terms of their dialysis as well as in terms of their ultimate outcomes.
The article that we wrote for the Harvard Business Review dealt with in what are called enterprise IT systems. So the point of our article is they're not just simply opportunities to reduce costs, but they're actually about improving care delivery and patient safety.
When I teach at HBS about U.S. healthcare strategy, the students come up to me after and start talking about their ideas for change. And a number of them go on to join entrepreneurial ventures and start forming them. And that's a very exciting approach to handling problems of the healthcare industry.
The real work lies in influencing the practitioners, who they're talking about, who they're trying to study, who they're trying to influence, and having a commitment to taking their work beyond a conversation with each other into the real world and having an influence on the world is one of the important values we hope to have every one of our scholars bring to the world.